Hi, I'm Megan Norman, and this is a new series called Made for Minnesota Moms. I'm a mom of 3 and a Minneapolis newborn and family photographer. I'm hoping for real conversations with Minnesota women who support pregnancy, birth, and postpartum, sharing resources you can actually use because the internet at 2 a.m. can be a lot. Today, I'm with Dr. Jess Roth from Chiro for Moms. She's a women and pediatric chiropractor and also a certified lactation consultant who combines bodywork with lactation support for mom and baby together, which I think is so cool and you don't normally hear this. So I just think I am very excited to hear your take on all of this and how you do everything. So, Dr. Jess, thank you for being here. And could you tell us what lactation support looks like in your world and what are the most common challenges you see with moms and babies?
Okay, so thank you for having me. I am excited. This is my passion project. I absolutely love lactation and chiro put together. I have a massage background, I have a personal training background, I have a chiro background, I have the lactation now, and I pull everything together. And so when lactation in my world combines with the body work, it means that we're able to focus in on everything, because what happens with the latch with the baby transfers through their entire body. So for me, breastfeeding is a full body experience. Mom's nervous system dictates baby's nervous system as well. So when mom's taken care of, it emphasizes on that whole lactation component too. So that goes back into the body component too. When mom's body is taken care of, baby's body is taken care of. And so for me, lactation in my world looks like a full, well-rounded system where we need to take care of mom, we need to take care of baby, but we also need to combine and make sure that that relationship between mom and baby is strong and like really strong in that way, as well as mixed in with their partner, whoever is going to be helping out with mom, and making sure that that mom is supported through and through with every aspect of her life, whether or not that's providing meals, whether or not that's providing a different support of any kind type of thing. And so for me, lactation and that in my practice encompasses it all. Does that make sense?
Yeah.
Okay.
It totally does. And did you, now that you are a mom and have been, because how old is your little guy now?
He's 8 months.
8 months, that's crazy. That went fast.
Yeah.
Did you find this, did you have this philosophy before you had him and then only strengthen it? Or did it kind of evolve as you've become a mom and realized the importance of all the different elements?
Kind of both. I had my certification with lactation before I had my son. And so I love treating babies through and through. This is truly my passion. And so I did have, I guess, an idea of what life would look like with an infant to help treat those moms and everything like that. But after having my own son and being through that experience, being through breastfeeding, being through the pain initially with breastfeeding and figuring out that own relationship between me and him, and figuring out what we need to do to kind of get past this painful part of breastfeeding, has opened up my whole entire world of helping other moms with their own journeys, whether or not they have low supply, whether or not they have pain, whether or not they have like the baby has a shallow latch or anything like that. It just kind of opened up my whole world of like, okay, we need to dive deeper into everybody's own experiences as well. So yes, my own experience was, I embrace everything about it, and I do feel it made me a better practitioner.
Yeah, 100%. And I think it's super interesting too, now that with my 3, every single one of them was different. So it's like figuring out how to feed them and be successful. And it is frustrating. So to know that there's people out there like you that are supporting not only mom, but baby too. And like just learning about all the ways that you can get the support in both ways to be successful. Yes. Yes. I love that.
Absolutely.
Oh, I love it. Okay. So when a mom comes in for their so I guess too, you see people that are coming in for both chiropractic care and lactation, or do you see just one or just the other? How does that work?
So my lactation visits, I always mix the two because
Okay.
as a chiropractor first, my goal is to calm the nervous system down and then add in that lactation component. So I am a chiropractor first and then lactation specialist on top of it, which is
Okay.
kind of like a double whammy as well. Because if the nervous system isn't calm before we're starting to latch, then we can have complications of like the baby is not settling at the breast. And so then it comes kind of gets into more like the anxiousness of like mom's not being able to calm herself down too. So we need to calm mom and baby's nervous systems down via chiropractic care, bodywork, that type of thing before we even do any sort of lactation. And so my lactation visits definitely go with both. And so I usually do, like, we always do health history and like history of like what they're kind of going through and stuff like that too. We usually latch baby on right away just so I can see what's happening. And then I mix in some body work, chiropractic care, and then we might do, we'll get on the other side as well, just to make sure that we can tweak different things, like whether or not that's positioning, whether or not, hey, let's do this stretch, make sure their body's nice and loose before we latch them on, and then see if that makes a difference on the opposite side. So I usually like to start on like the good side and then do the body work and then get them on the bad side to see if that makes a difference right then and there. But it does take time.
And that's a good thing to point out that I forgot about is you do have one breast that will supply more than the other, and you just learn that right out the gate as you start to do it. So I forgot about that until you said that. So that is a very good point. I also, as you're talking about calming your nervous system, I can put myself back in those situations, right? When they're all three trying to figure this out. I'm trying to figure this out. They're upset. I'm upset. So focusing on your nervous system and calming it down is genius, because you just like recenter everyone and everyone's in a much better headspace, including baby. I totally forgot about that. That's such a good point. That's such a good point.
There's been some times where I, even at home, I'm like, I'm more anxious and I'm like, I need to get my baby to eat because we need to get going. I'm just like, okay, Mike, he's my husband. I'm like, take the baby. I need to step outside, take a couple deep breaths, and then I'll come back, recenter, and then we'll try again because and then he'll have a good eat, and then we're able to leave the house. And so just making sure that you're centered first before latching your baby on can make the world of a difference.
That's so smart. And just to say, I need to take a beat. I think we forget about it because we just want to do everything. We want to be all the things.
We're doers. We want to help. Our baby is our lifeline, basically. As soon as we have our baby, I've been asking a lot of parents, like, what's the best part about becoming a parent? And for me, I want to make sure that everything's okay for him. And so when he's upset, of course it makes me upset. And so, but just remembering that it's okay to take a second and then come back to it. Yeah.
Yes, like the way that the three, like for me, I am only as happy as they are because they affect so much of my world. And like you said, you want them to be happy and you do everything to do that. So it's so interesting. One of the questions I guess that I'm super interested in is how does the birth, like vaginal, C-section, longer labors, how does that impact feeding? Like, is there anything with that?
Yes. So it kind of goes back to, so I'm just going to kind of touch on cesarean versus vaginal right now, and then we'll kind of touch into fast deliveries with vaginal and everything like that too. So we have specific reflexes that we go through the canal with. So when we are born, we're supposed to twist in the canal certain ways so that those reflexes, those innate reflexes that are in our nervous system when we're in utero get recognized, they get triggered.
Like triggered? Yeah,
exactly. And so when we go through the birth canal, those reflexes get triggered so that we're able to have innately just automatically start to latch automatically, because that reflex comes on right around 14 to 16 weeks when we're in utero.
Okay.
And so your baby automatically knows how to suck before they're even coming out. But those reflexes coming through the canal make it so that they're able to feed almost instantly, type of thing.
So cool.
Yes, labor is vigorous and is tiring. Also, when we come through the canal, we get way better bacteria. We get the good bacteria. Yes, that is still with the cesarean, but we get that good bacteria to go through the vaginal canal, which also helps the gut lining, which helps with lactation. And so,
Interesting.
and then mom's breast milk, the colostrum, this kind of comes in first, and then the milk comes in later. Quote unquote, because milk is always there. Colostrum is technically milk too. But with that, it coats the gut lining and it helps protect your baby's gut. When we are
Interesting.
born via cesarean, we are born into a very sterile environment. And so breast milk is going to be one of the best things for those babies just because it is introducing those bacteria, but they don't automatically get the good bacteria coming through the vaginal canal. And you don't necessarily get all of those reflexes when you're coming
Okay.
through via cesarean. But at the same time, your baby's born with most of those reflexes, because they were already in utero. They don't necessarily get 100% triggered. And so breastfeeding via cesarean might be more challenging. And I say might be because most babies are totally fine latching on right away with mom via cesarean. And then with fast delivery and with like super fast delivery or super prolonged labor and stuff like that, that's a lot of tension. That's a lot of squish that's happening. And so with a really fast labor, I had a mom with a 40-second push out. Like baby was
Wow.
out in 40 seconds.
That's
She was in labor
impressive.
for like 3 hours, but then 40 seconds to come out. I'm like,
But
oh,
still,
and
wow.
then so
She needs to
baby,
watch out if she has any more kids.
no, right? But baby has so much tension because that's a lot of squish happening all at once and then shooting out the canal
Yeah.
and stuff like that. And so right now we're working on lengthening the baby out and just helping the baby relax because of how quick it was. And then
Good
same thing
point.
with a prolonged labor. They had a lot of squish for hours on end. And then when they come out, they might not want to be touched. And so pulling them to the breast, they might be a little bit more frantic. They might not wanting to latch right away because they were compressed for so long that they're like, let me just have some space. Let's do some calming techniques first. So both fast and long labors do impact how the baby is going to be breastfeeding. But most of the time babies are successful with no matter the labor.
That's so interesting. I guess I figured there would be some differences, but it's so interesting to hear the reasons why, and it makes a lot of sense. And I will say I did not have my 3 come in and see you guys when they were born, but I see the benefits and I hear the benefits from some of my clients and from you guys. And so I think I don't know. I think some people get nervous or like, what is chiropractic for, what is pediatric chiropractor and like, what does it do? And like, how do you adjust them? So I would love to hear that from you because I've heard it from clients or like, people, your clients and people come in, but it would be so interesting to hear like your philosophy and what you do and all of that.
Yeah. So basically, my practice, we do a ton of craniosacral therapy here. And so what that means is it's a very, very gentle touch all over the skull. Think about it like a coin, like a nickel resting on your hand. That's the amount of pressure that we're going to be using on your baby's skull. What that does, we have brain fluid that flows up and down our spinal cord. When we're doing certain pressure points along the skull, it helps to move that fluid around a little bit more simultaneously so that it pumps up and down that spinal cord, bringing on that relaxation component. So we do a ton of that with babies. And then with chiropractic care, it really looks like a baby massage. So think about you checking the ripeness of an avocado or a tomato. that's the amount of pressure that we're going to be using on our itty bitty babies, because babies aren't just mini adults. They are their own person. They're very cartilaginous. They're very malleable. They're very stretchy. They're very just itty bitty that we can't use our adult techniques on infants. And if anybody does, please don't see them. But it looks like a baby massage, and it's truly just mostly just trying to bring in that relaxation component to the joints, making sure that they're moving, they can raise their arm up. What if their shoulder's a little bit sticky? I'm just going to kind of massage and help that down so that they're able to raise it up a little bit easier. Same thing with their legs, making sure that their hips are moving nice and loose, making sure that their spine is nice and just a little bit more flexible so that they're able to wiggle around. And then when they're latching on the breast, they're not like stuck. And so we see this a lot with torticollis, actually. Torticollis is a condition where you are favoring one side and then you have trouble looking towards the opposite side. And so with breastfeeding, let's say baby latches really well on the right breast and they struggle on that left breast. Well, it might not have anything to do with mom. It might actually be that their structure, their little tiny bones in their neck, or their muscles are super tight that they can't actually look that way, so they're going to be more uncomfortable. So that's when chiropractic comes into play, is making sure that baby's able to move all directions to make it more comfortable for feeding on mom and for feeding, like baby feeding.
So interesting. It is really cool to have seen to just how calm, like there could be a baby that's upset and like just those few gentle touches, just it's like a calming. It's pretty cool to see. I bet you see, I mean, I'm sure you see it all every day, multiple times.
Yeah, I do. And like, not joking, your baby might cry during their visit, and that's okay, because they're uncomfortable. They might fall asleep during their visit, and that's great. They might get hungry during their visit. That's okay. We'll take some time. We'll get them on the boob and see what they need. So it's always like the baby guides the visit. And so it totally just depends on what the baby wants to do in that moment. If they want to cry, great. If they want to sleep, great. If they want to smile at me and coo, great. Yeah.
I mean, that's what I truly love about Chiro for Moms and Chiro for Kids, is just how you meet everyone where they're at when they come in. It's not like a rushed appointment. It's really, taking care, because it is self-care. Like, that's why you're coming in. That's why you're bringing baby in. And you can, like, when Dr. Jessie, when I talked to her, one I also think is really cool is how if you have mom and baby in, mom can be getting treated at the same time that baby's getting treated. And that's just wonderful. I mean, it doesn't get any better.
It doesn't get any better.
No, it's really wonderful. Doesn't.
Yeah.
Oh, I love it. Okay, so what are some signs a feeding issue isn't just about milk supply?
Okay, so feeding issues. So let's say that mom has pain. Pain is one of the biggest indicators that something is going wrong, whether or not it's something happening with mom's nipple or something happening with the baby not getting a deep enough latch. Latching, like deep enough latches, are one of the main things that I do see. So a shallow latch per se. And so whether or not the baby doesn't open up nice and wide for mom, or if their tongue can't come out past their gum line, or if they have a super high palate, or if mom has a more flatter nipple, or those are like the biggest common things. Is pain is the biggest one. Mom, you might see like the nipple shape go into more of a lipstick formation after you're done feeding, or you might see some different colors, like your nipple might turn white. That's not necessarily supposed to happen. Okay. And so, or baby might be uncomfortable. Baby might start screaming halfway through the feed, or they might start popping off consistently when you have a letdown, when you have a really strong letdown. They might, all of those things.
Yeah.
but pain is the
Well,
biggest one.
I
Yeah.
think so often, I think we go to it's a supply issue when
Yeah.
I really learned with my second one, it was about making sure that I really opened, like dropped his chin and like he got a really good latch because I
Yeah.
didn't I didn't have that with my first one. And
Mhm.
so you realize with each child how different they are, even as they get older,
Absolutely.
and how you have to parent them and do things so much different.
Yeah.
And so that was one thing I really learned was making sure that I like
Mm.
opened, like dropped his chin down more so that he
Yeah.
could get a better latch. It
Yeah.
was just interesting. Like,
Yeah.
because I
Because I'm
think we
sure,
do.
yeah,
Oh,
like let's say a straw for an example. You don't drink like down like this because you can't suck. You open up and then you suck, right? And so just making sure that you're elongated in your neck. Same thing with a baby. If they're going to drink from a fire hose, you want to make sure that they're open a little bit
open up.
instead of looking down because that can cause a lot more like coughing and stuff like that and popping off if they're uncomfortable that way. So same type of thing that you were saying, Megan, about making sure that they're nice and open in order to make sure that that latch is better. Yeah.
But you don't even think about this. That's why
You
it's so
don't. No.
wonderful to
Yeah.
know that there's someone like you who is
Yeah.
there to like just talk
Yeah.
about this stuff and look at everything because you've seen it all, like all different shapes, sizes, babies,
Yeah.
like everything. And so just to have someone that you know understands, has seen it all, and you can go in there and just feel comfortable asking questions and making sure you understand. And you guys have so many good resources too
Yeah.
for like if there's tongue tie or there's all
It
like
needs to be something.
yes.
Yeah.
Yes.
And even for like my own personal experience, like, yes, I am a lactation consultant, but as a mom, I can't see. Like, you need that other
Good point.
person to like see what is kind of going on. I actually had a lactation consultant come to my house, one of my good friends, because I was
Smart.
like, something's going on. I think I know what he's doing, but I'm not sure what he's doing. So can you just come double check this for me? Just because I can't see what I'm doing when I'm trying to feed my own child, right? And so just making sure that you have like essentially an outsider's perspective as well, because truly you can think you see everything that's going on, but there might be just one tiny thing that you can make that much better. Yeah.
100%. I mean, that's why I love this whole series too, is because I don't think we realize all of the people out there that are supporting women and want to help and truly love what they do, and that this is their passion, like you said. And so it's just nice to know these resources and people you can reach out to, and that you're not alone, and that this happens to so many people. Because, like, even like I said, my first one, it worked out. My second one, I needed more help and support.
Yeah.
And that's totally fine. And that's why you're here and like wanting to do it and love doing it. So I just think it's so cool.
I love it.
No, I love it. Okay. One of the other things is and I already know the answer to this, but I can't wait to hear your answer, is can chiropractic care support babies with reflux, gas, and fussiness related to feeding or just in general?
Absolutely. So how much do you want me to dive into it?
Well, it goes back to the whole nervous system and like alignment, and that's what I think is so cool.
Exactly.
So you go into it as much as you want. I think it's so fascinating.
Okay, so I can kind of relate everything back to the latch, because if we're having reflux, there's a couple of different scenarios, but one case, if baby's getting too much air in their tummy, they're going to have a little bit more uncomfortable. They might have a little bit more spit up because they're trying to pass that air. They might be more gassy. They might have like more colicky type symptoms. Yes, colic is a true diagnosis when other things are ruled out, but when it's related back to getting in air and everything like that, we can help with that for sure. And when it comes to reflux, we need to soften the diaphragm. The pelvic floor and the diaphragm need to start communicating together instead of getting that pressure against one another. So when we start getting that communication going, the reflux go down, the gas pains go down, the baby's more comfortable overall, meaning that they might eat a little bit more. But everything kind of intertwines with one another. And so chiropractic care So we have a couple different spots on our spine that control our rest and digest part of our nervous system. And then we have our sympathetic nervous system as well. So we have two different parts. Well, we technically have three different parts of our nervous system, but the two different parts, rest and digest and sympathetic, neck, low back, those are our rest and digest. So when we stimulate those two areas, that helps our body calm down. It means that we're safe. It means that we are able to regulate a little bit better. Our mid back, right about this area, is our more sympathetic, which means that it's a little bit more of our fight or flight. But all of our nerves communicate with everything that's going on in our body. And so if we are dealing with a diaphragm thing causing reflux, I'm going to be adjusting in here because C3, C4, C5 keep the diaphragm alive. And so,
Interesting.
yeah, so if we're having any sort of reflux, breathing things, I am going to be adjusting the neck because that's just where those nerves go to communicate with the body. If we're having bowel issues, any gas, fussiness, where I'm going to be adjusting the lower back because that's our rest and digest, but all of those nerves communicate with the colon. And so in our spine, all of those nerves branch out and communicate with every single organ in our body. And so targeting different areas of the spine, bring more communication means that more relaxation type of thing.
Interesting. That's so
Make
cool.
sense?
And what's really cool about it too is like when you say adjusting, like you're doing like the smallest,
The very, very small jaw, like the baby massage, like I mentioned before. Yeah, truly the baby massage. Yeah.
And it doesn't take much, and you see like you can see instant relief, I'm sure, is what.
Yeah. Essentially, yeah.
I think that's so cool. Okay, so when should new moms consider seeing a chiropractor for themselves or for their baby?
Is this postpartum moms? Or is this
probably. Yeah, well, because I know when Dr. Jessie was on, so the very first episode, when she talked about how often she wants to see people, and really it was only like 4 to 6 times throughout their pregnancy, how much of an impact that had with labor, which blew my mind. I had no idea, which I should have. Of course, it makes sense. You're like aligning everything and like getting everything, like you said, like your nervous system calm down and like just aligning and everything. But like after baby, so once they have baby, so when should you, when do you like to see new moms, or how does that even work?
Yeah. So it depends on what you're going through. So let's say, like for me, personal experience going through labor, I was in here 3 days after because my tailbone was achy. And so totally depends. I've seen moms the day after. I've seen moms 3 months after. I've seen moms a year after. It totally just depends on what you're going through and if you want that extra support with your body, because there's lots of changes that are happening. And so if you are nursing, you might feel a little bit heavier here, which means it's going to pull on your upper back. You're looking down at your little one all day long, and so your neck might hurt. And so those types of discomforts can happen pretty soon post-delivery. And so I'm a big believer of getting in whenever you feel comfortable, but for sure, probably within 4 to 6 weeks. Post-delivery would be amazing, because then we can kind of get ahead of everything instead of like 3 months down the road. Well, you've been holding your little one for 3 months and now we got to undo those muscle tightnesses and stuff like that. So for a general guideline, 4 to 6 weeks for mom. But the sooner the better whenever you're feeling it, or if you don't need it at all, then totally fine. But for baby, again, it's totally depending on what your guys are going through. If there is any nursing struggles, the sooner the better. So if you are struggling with nursing day 1, day 2, day 3, let's try to get you in super soon and just get those combated, because the first early couple of days are huge for milk supply, and we don't necessarily want to wait on that one. But if baby is doing really well, gaining weight, thriving, and everything like that, and then I say they like to show their true colors right around 2 weeks, because you have this like 2 week of bliss type of thing, and then they start to have, they might have a little bit more gassiness, they might have a little bit more reflux. Those symptoms, those common symptoms might start to arise. And so probably around 2 weeks. If nothing is kind of going awry, 2 to 4 weeks is a good timeline for baby. But of course, if anything is kind of happening, the sooner the better.
Awesome. Okay. And okay, so these last two questions are they're like been my favorite to ask because I love the answer. So what's one thing that you wish every mom knew about chiropractic and feeding or lactation support?
One thing that I would like mom to know, that it is definitely your preference. Like, you're guiding every single visit that we are going towards. So I'm focused on your goals, making sure that you're comfortable, making sure that baby's comfortable, and that your relationship is the most supported, because that is going to be the most benefit for your journey. Whether or not your journey with breastfeeding is 1 day, 1 week, 1 month, 1 year, it doesn't matter, as long as you're taken care of and your mental health is first priority and stuff like that too. And so making sure that mom is definitely taken care of. So when it comes to chiropractic care, it goes back to that nervous system based piece. Taking care of mom takes care of baby.
100%. And I can say that I have seen you, I've seen Dr. Jessie, like you guys, like Dr. Beadle has seen my daughter. Like, there's always the patient care first. Like, you are most concerned about them as a person, and you're there to support them. You're there to just make them feel better. And I think that as moms, we put a lot of pressure on ourselves, and we think that we should do it all and that it should come natural. And so it's really nice to know that you can come in and see Dr. Jess and know that you're supported and that she's there to support you. She's not there to shame you. She's there to hopefully make your life easier and just be a support system and someone you can talk to who has tons of experience. She's a mom herself. She's just went through it. Like, she's still, like, she knows. And so I love that, because it's how you guys practice.
One of my favorite things to tell patients right now, because like what you just mentioned, I'm going through it, is if you need to email me at 3 a.m, chances are I'm going to be awake too. And so we can have that email conversation at 3 a.m. if you really want to, just because I'm awake always. So yeah.
Well, and that's true. It's like you are the fourth one that I've interviewed now, and there is like such a theme to this of genuine care for your patients, for the people you work with, and their wins are your wins. And so you just said it right there. Like, you want to support them, you want them to feel supported, and you're there. I just love that. Okay. Can you share one powerful moment from your work that you'll never forget?
Oh God. Do I have to pick one?
I know. That's what everyone has said. Everyone's like, I have so many. But yeah, if you what stands out, or what two stand out?
Oh gosh. Let me think on this one.
Okay. I know. It's a hard question. It's like
a hard question.
Yeah. Has anything like stood out or some? Yeah.
Yeah. I guess this one definitely stands out quite a lot. Mom had baby on time. Baby was like 40 weeks, which was amazing, but baby was struggling with their latch afterwards. And so mom really wanted to have breastfeeding work. Of course, we all do, and everything like that. But baby had a pretty significant tie. The tongue didn't want to protrude out. It wasn't reaching the roof of their mouth. They were arching profusely. They were really uncomfortable in their little bodies. And we did about a couple of visits with chiropractic care. We did do our lactation visit, then off on the tie, and then we did a couple more chiropractic visits to see how we can loosen off the body. And mom was very, very, very nervous about doing a tie release. And I respect that because I also had to do a tie release with my little guy. I was also nervous. And so we kind of
Yeah.
chatted through it, mother to mother, and everything like that. And so then after the tie release, everything kind of just changed and for the better. Mom's supply went up. Baby is reaching the roof of his mouth. He is now comfortable. He's comfy in a car seat now, whereas before he was trying to arch away. He is eating really good. He's a big boy. And then mom's latching well, and she's like, why didn't we do this before? Like, why was I even stressed out about it? I'm like, because that stress, you want to protect your baby, and that is natural. That is, you want to take away all the pain, all of the discomfort that your baby might be feeling, because that's you as a mom. And so just know that every single mother has to go through something in their life, whether that's a tie release, whether or not that's your kid scrapes their knee, and you want to take away that pain for your little one. And so that was kind of a powerful moment for me, was like, as a mom, we want to take away everything that our child has to overcome or deal with or anything like that. And just seeing her go through this journey and realize that, yes, we had to do something like this. And now their relationship is that much better too.
Well, and with tongue ties and all of that, I don't feel like, I think you guys do a really good job of sharing about it. I just don't know how much it's talked about, and that it's a normal thing. But like, you just don't know what you don't know, and it's scary.
Exactly.
And they're little, and you're
scary.
going through all of these hormonal changes, and you have all these things, and you're not sleeping. It's really hard to make decisions.
So very, very hard.
It's nice to know that you can talk. And like, again, you talked about it. It's not like you're telling her, you have to do this. This is the only option. Like, it's just like, let's have this conversation. Like, I'm just going to share with you about my experience. And and honestly, that's a lot of times all we need to hear is like someone that we trust who has gone through it, and this is their experience. And it just helps. It's a lot. Like, I just want every mom to know that it's a lot in the beginning. It's a lot. You're not sleeping.
Like,
yes, it is crazy. It is crazy. And so giving yourself enough grace and know that you have people here to support you and love you and like want to help you, and you don't have to do it all yourself. And I think we're just really hard on ourselves.
We are really hard on ourselves. Give yourself, you need to give yourself grace.
Exactly. You're doing the best you can. And some seasons you can do more, and other seasons you can't. And there's nothing wrong with that. It's like, you figure out what works for you.
When you're in the early phases, do less. Don't do your laundry. Don't worry about the dishes. Just let someone else take care of that for you if you have the opportunity to do that. Truly, the goal with like motherhood right in the initial first couple of weeks is do less. Just spend time with your baby. That's all.
Snuggle more, do less.
Snuggle more, do less.
I feel like that was one thing that I really tried to embrace with my number 3 was like days would go by so fast because all we did was snuggle, and I would feel somewhat guilty about it. But I was like, no, this is my job. Like, I spent all this time making this human, and now I'm going to enjoy him and take care of him and myself. And if you can do that, please do it, because it's so important
I
this is
still
so
do
good.
that. Yesterday I was supposed to make supper, and I took the meat out, and that's as far as I got because my son wanted to climb on me, and I'm just like, that's okay. We're just going to spend the next 30 minutes cuddling. And then my husband ended up making supper because he's like, Jess, I thought you were going to do this. I'm like, I got sidetracked. Sorry. Oopsie.
I know.
Yeah.
I know. Well, it goes so fast. So enjoying each moment when you can, and like trying to soak it in as much as you can. It's important.
Yeah.
No,
Exactly.
this is so good.
I love it.
I would love to, is there anything else that you want to talk about? If not, I would love to have you tell where people can find you, how to make appointments, like all of that kind of stuff too.
And so I'm sure Dr. Jessie touched on this earlier in her interview. We are not pressure. We don't have pressure at our clinic. You can email us with any questions that you might have. You don't need an appointment to ask questions. If there is anything that you need, just reach out to us because we are always available. You can find us truly on Instagram. We have Chiro for Moms. We have Chiro for Kids. We do have pelvic floor for moms. I'm not on that one that much, but if you need to reach out during that one, totally fine. We have our website, Chiro for Moms, that you can reach out with. And then if you have any questions about like appointments, appointment styles, or anything like that, truly just send an email. It's team@chiroformoms.com. So always ask
Awesome.
questions. Ask more questions.
Well,
thank you.
I so appreciate you taking this time to talk with me about all of this. I find it super, super interesting. And yeah, thank you.
Thank you so much for having me.
Thanks for listening. And now for my quick disclaimer, the part I have to say out loud. This interview is for educational and informational purposes only and isn't medical advice. For guidance that fits you, talk with your healthcare provider. Thanks for listening to Made for Minnesota Moms, and I can't wait for the next interview.